Hello and welcome to TruST TV. I'm delighted to be joined again today by our Chief Executive, Dr. Maria O'Kane. Maria, you're very welcome.
Thank you, Ruth. Always delighted to be here.
Good. We've had our monthly Trust Board meeting today, where the outcome of our consultation on improving services for patients with dementia was discussed. What decision did the board reach?
Following the consultation that was held at the end of last year, the board has reached the decision that we will now hold the dementia unit on the Craigavon site. Now, as people know, this comes on the back of really significant staffing challenges when Gillis was based in Armagh. We moved the unit across temporarily, and we have had it there now since May last year, and it has been working successfully. Now, what we plan to do over the next period of time then is progress our business cases around developing the facilities on the Craigavon site so that we can provide comprehensive dementia services, both as inpatients but also then as outreach services across the Southern Trust. So over the next year to 18 months, we expect to see an improvement in terms of our facilities there so that we can provide even better care. So we know by the year 2032 that we will have the highest levels of memory difficulties in the over 65s. So again, in terms of future-proofing ourselves and making sure that we're in a position to, receive and care for those patients, it's really important that we move forward with this work now.
So this really will improve services for patients with dementia.
Yes, that's definitely our expectation. And given that this is one of the side effects, unfortunately, of us, living into much longer old age, we've got to make sure that we provide good quality care for people, that they can continue to live meaningful lives, whenever they develop this condition.
Now, we have another public consultation underway at the moment considering the future of emergency general surgery at Daisy Hill Hospital, and it's proposing that emergency general surgery for the whole of the Trust area would be delivered through Craigavon Area Hospital, and that would be on a permanent basis. So why are we recommending this?
Well, this is part of our modernisation of services across the Trust generally. And I think based on the experience, particularly of the Scottish health system, who, are not dissimilar to ourselves in terms of having people over a large geographical spread with, increasing challenges with staffing, we consulted widely with them and with other people to develop this model. And certainly it has been temporarily in place since February last year and has been running very successfully. And from our point of view, we also know that we are really expert now in managing patients who are very unwell and can transfer them if necessary to between Craigavon and Daisy Hill, with the excellent anaesthetic support that we have. So, and again, that was one of the things that we really developed and have learned to do very expertly in the course of COVID. So the rationale behind this is that we concentrate our expertise on the one site with outreach to Daisy Hill to provide elective surgery. We will still be providing on-call facilities and backup to the services in Daisy Hill, but actually in terms of undertaking the emergency surgery, it will happen now on the Craigavon site. And the benefit of that particularly is that the outcomes will be better, and we're seeing that already, because for people who are at a distance from the experts, the evidence base is very clear that their outcomes cannot be always as good. So again, from our point of view, this is very much about improving patient safety. Also, I think creating a sense of psychological safety across the population of Newry and Mourne and our own staff, so that we know that we're providing really excellent care. And also, I think the added benefit from our point of view is that it really concentrates our surgical resource into developing teaching and training and being a place where people really want to work, so that they can have really robust experience of providing good emergency services for surgery, but also can be trained up in elective surgery on the Daisy Hill site as it continues to develop. So not only will we be providing safer and more robust services for the people of Newry and Mourne, we will also be helping to address these awful waiting times that we have across the whole of Northern Ireland in relation to surgical waits.
But one concern that has been raised about this, Maria, is that it will impact on the emergency department at Daisy Hill. But you have been able to provide reassurance that there'll be no change to the emergency department.
No, there's absolutely no change to the emergency department in Daisy Hill. It is a level 1 ED. It has 24 hours a day consultant emergency doctor cover, and there are no plans changed to change any of that in any shape or form. And in many ways, I think this has been really helpful in terms of sustaining the resilience of the emergency department in Daisy Hill and surgical provision across the trust, in that we have very clear pathways now in relation to where the 5 or so patients a day who need to be transferred to Craigavon can follow, and again, a very responsive, timely access for all of that. So there's a great level of confidence among our staff in the emergency department in relation to working in this way. And I think that certainly helps us in terms of, again, providing psychological safety for staff there, and also encouraging others to think of Daisy Hill Emergency Department as a great place to work.
We've mentioned staffing challenges quite a bit in this conversation. It seems to be a theme, and it has also been affecting our stroke service in Daisy Hill recently. But you had some good news on this front for board members today.
Yes, we know that the stroke service in Daisy Hill has always depended on a small number of staff. And in recent times, for different reasons, those staff haven't been able to be available. And it's important that we provide safe services for patients, but also that we don't place an unnecessary burden on a very small number of people at any given time. So on the basis of that, we temporarily suspended the provision of stroke services on the Daisy Hill site, and those are being carried out in Craigavon. And again, that has been working successfully, but we do plan to return to the provision of stroke services after Easter, when we have got the complement of staff in place again.
So that's great news. And there was other good news then this week for the Newry and Mourne area with the announcement around the Community Treatment and Care Centre.
Yes, this is a bumper week for Newry, in that we again will be taking possession of Monaghan Row as a means of expanding the Daisy Hill site, and the amount of work that then we can provide on that site, particularly to the people of Newry and Mourne. And then secondly, in relation to the Community Treatment Centre in Abbey Road. So the department has provided us with the funding now to move ahead with the plans in relation to that. So again, from our point of view, that's really important. So we've received 4.5 million from the department to purchase the site at Abbey Way, and the associated design to further progress the Newry Treatment and Care Centre. So, as we know, we've had a number of unavoidable delays in this project, and we're delighted now that we're able to take this forward. The beauty of this new centre is that it will bring together a wide range of services which are currently delivered by around 600 staff across 13 sites into a much more modern and suitable accommodation. The centre itself will offer a range of planned outpatient appointments, diagnostics and specialist clinics, really complementing the high quality work that goes on the Daisy Hill site. So we anticipate this will free up some of the capacity in Daisy Hill to actually do more complex work. But because some of what we provide there could be done in the community treatment centre and other places. So that's part of all of this. So we are working through our outline business case in relation to all of this, in terms of developing this. And the next process then is for us to secure the capital funding so that we can start to actually build this and we can see the bricks and mortar in place. And then at the same time, as I mentioned, we have purchased Monaghan Row. So we will begin to move in there in April. And again, this offers a really exciting opportunity in terms of building the resilience of Daisy Hill Hospital. It will give us a bigger footprint across that site, provide us with more capacity, not just to do more outpatient work, but also then to provide premises for others to reach into Daisy-Hill and make the services more robust there. So this is a very exciting development for us, and certainly we're very grateful to Newry and Mourne Council for offering us this opportunity and working, I think, really constructively and efficiently with us to deliver this as quickly as possible.
So that is just fantastic news for our population in Newry and Mourne. Dr. Maria O'Kane, thank you very much.
Thank you, Ruth.